Okay, well, thank you everybody for joining us for this press briefing on what the state is doing to slow the spread of coronavirus here in the state of Nebraska. So as always, we want to remind people about testnebraska.com, and we want to remind people that even though yesterday we announced the loosening of some restrictions starting June 1st, that through the rest of the month of May, the DHMs and guidance and all the other things, the restrictions we had before are still in effect. So for example, for Memorial Day weekend, 10-person rule is still in effect, so please, best practice would be celebrate with just your household, but keep all celebrations to 10 people or less as you're doing those grill outs and everything this weekend. So please keep remembering all those good hygiene, 6 feet distance. If you're going to go to a store or someplace like that in public, wearing a mask is going to be a good idea. Wash your hands frequently for 20 seconds at a time. And of course, if you are sick, please stay home. Don't take the chance you're going to spread the virus to somebody else. And of course, all these restrictions we put in place have been put in place to make sure we continue to preserve our hospital data. We've got 43% of our hospital beds available, 36% of our ICU beds available, and 77% of our ventilators available. So we have continued throughout this emergency to preserve our hospital system, make sure we've got that hospital bed, that ICU bed, or that ventilator available for anybody who needs it at the moment they need it. We want to continue to make sure that's true. As we look at loosening restrictions in June, we need people to continue to make sure you're practicing good physical hygiene by washing your hands often, that you continue to keep 6 feet of distance between you and other people. And again, if you're going to go in public, wearing a mask is always going to be a good idea. TestNebraska.com, we've got actually almost 150,000 people now signed up. We're at 148,000. And we have Test Nebraska sites next week are going to be in Lincoln, Omaha, Hastings, Kearney, York, Seward, Beatrice, and Clay Center. So again, please continue to sign up. And I know that we've had people who have signed up who are eligible to get a test, who have been looking to get some test slots scheduled, but haven't been able to do that. Please keep trying. We will continue to have more slots opened up, so please keep trying to get those slots scheduled. We appreciate it. Also, one of the things that I want to talk about a little bit with regard to this is just some of the data that Dr. Audie Poor talked about from Douglas County. Now, we've talked about Douglas County and Lancaster County have been tracking statistics based on race and ethnicity, and we're working with our other public health departments to be able to track that as well, and hope to have statewide data here. We're supposed to get that for the end of the month. But I wanted to share some numbers that Dr. Poor shared with regard to Douglas County. So African Americans make up about 11.4% of the overall population in Douglas County, and have about 10.2% of the cases that have been reported have been from African Americans. So again, roughly in line with the population there. However, the Latino community is about 13% of the overall population, and they make up 47.3% of all the cases testing positive. So again, being disproportionately impacted by this. Asian Americans, 4%, and they make up 15.6% of the people who are testing positive, and Caucasians, who are about 80%, are 17.5%. When you look at the death data, though, the number of people who have died, if you look at Latinos, they make up about 10% of the overall fatalities, Asian Americans about 21%, and Caucasians about 68%. And so, folks, the message I want to get out here today is that, look, this virus does not care what the color of your skin is. It does not care what race or ethnicity you are. If it can get to you, it wants to infect you. And in some cases, especially if you're older with underlying health care conditions especially, it can be very dangerous. So please remember, do not stigmatize anybody who has been infected, who has come down with the virus. We need to make sure that those folks are being taken care of. If you can isolate at home and prevent the spread in the community, that's best. If you need to go to the hospital, go to the hospital. But remember, folks, that this virus does not care what the color of skin is that you have. It is trying to infect you. And again, that's why we need people to continue to practice our good physical distancing, washing your hands, good hygiene, all of that. We need people to continue to practice that throughout the duration of this emergency. Now, yesterday we talked about some of the restrictions we're going to be loosening up in June, and we have our Commissioner of Education, Matt Bloomstead, here to talk about graduations in summer school and how some of the loosening that we're going to be doing in most of the state is going to be impacted or will facilitate either summer school or those high school graduations that have not happened yet. So Commissioner Blumenstein, I'm going to ask you to come up and say a few words about that.
Thanks, Governor. And the reality is, as we continue to try to open school environments and settings, we're obviously really trying to emphasize that people are very cautious, as the Governor talked about, really thoughtful about building plans that help promote social distancing and proper procedures relative to ensuring that everything that we do really slows the spread of the virus. So that remains critical. What I'll tell you is we've had school officials working statewide on our Launch Nebraska effort. So it's www.launchne.com. Those procedures and processes are really kind of taking shape on how we can open environments, what the physical environments look like, what all of the procedures need to be across the board. And we've talked for a long time that we need to learn in summer, and not just our students. We want an opportunity for our students to learn, but really we need to learn how we're going to be able to start to restore good practices in schools that are going to keep our children safe and keep families safe and help slow the spread of the virus overall. But I am actually very excited. We've had conversations, given the loosening of the other DHMs, that really moving towards a summer learning environment is going to become possible for us. At least some in-person possibilities are going to be there. We've chosen to use largely the 15 student environment based on the child care guidance perspectives, and plus we're going to need to step slowly into those environments as schools try to figure out what those best processes happen to be. Number one for our schools is a real interest in serving students that might have number one, special needs and need some one-on-one attention, serving students that maybe have been in a position where this remote learning environment was not ideal, and an opportunity to really help them catch up on anything that might have been unfinished learning for them. Moving forward, ultimately down a path that we can enter into those environments in a safe way and figure out a whole bunch of procedures I think will be necessary. Just this week, also the CDC started releasing guidance on what school environments look like. I encourage folks to take a look at that in addition to our Launch Nebraska site. But there's a lot of details to be thought through, a lot of work that we'll continue to do. I'm really proud we have efforts going on all across the state, groups in the Omaha metro area working together to be thoughtful about what those environments need to look like here in Lincoln, Lancaster County, and then statewide. Even our Nebraska Rural Community Schools Association, just today I was talking to them about having over 100 superintendents in different groups talking about what the environments are going to have to be as we continue forward. So that's going to be critical work as we continue on. Really also very important to schools across the state has been graduations. The new DHM actually allows venues to open with limited capacities. We believe that graduations can take place underneath those DHMs in a certain fashion, and I'm not going to be able to cite all the numbers. I'll let the governor do that. But I know that it's about 25% of venue capacity typically. So an outdoor graduation, for instance, in a school district's football stadium, for instance, is a possibility with those limitations. Part of that is, as it goes up to a certain number, we're asking school officials to work with their local public health officials to build that plan and make sure it fits the requirements of the DHM. Also, we'll see that there were several schools that put graduations late in the summer, end of July, first part of August. We'll continue to monitor and watch what the environment looks like. We certainly are continuing to have conversations to ensure that there's good communication between our local public health officials and our school officials to build those plans. But I think many across the state will feel this is a good sense of relief and a way to kind of put some closure on the school year for the class of 2020 that we've celebrated. I will say that just overall, the efforts are going to be important for school officials to continue to learn in these summer activities and even in the graduation experiences, understanding what it takes to kind of gather with folks in a safe way, ensuring that we're thinking of those processes. So really, again, summer is a learning opportunity, and I really want to focus that every step that we take has to be thoughtful and watching the environment that's taking place around us, ensuring that we're thoughtful about the practices that students, parents, family members take, as well as what the messages are from schools. One thing I tell you, like on graduations, for instance, is an important message is this is not the time to hold large family gatherings and ceremony, after a ceremony. It's like we have to be very thoughtful about how those environments come together to ensure safety for the long haul. So I really do appreciate the governor's efforts, all the governor's team that's been doing this. I know the phases across the state will be important to kind of collectively understand this, and I think it's going to help to be able to move forward productively and continue our planning as we look to really work with schools to launch into the fall as well. So thanks for the opportunity to be here, Governor, and I'll stick around for questions, as I know that routine anyway.
Well, thank you very much, Commissioner. And just so you know, it's 25% of the rate occupancy of the venue, not to exceed 3,000. And in Douglas County, if it's greater than 1,000, that's when you're required to work with the public health department. 500 in the rest of the state. So.
I knew you knew that.
And groups of 6 people, 6 feet apart from everybody else, all that sort of stuff. So we still have lots of restrictions on making sure we got good social distancing in all those venues. But yay, graduations. So good deal. All right, next I'd like to call up Dr. Kelly Kaburagi, who is the Vice President of Education at Nebraska Medicine. He has been working with regard to the training aspect of what we're doing as we respond back to this pandemic emergency and making sure we've got good training resources out there for the folks who need it. So Dr. Kaburagi, if I could ask you to come up and say a few words about that.
Thank you, Governor. It's my pleasure to be here, and good afternoon to everyone. As the Governor mentioned, I'm excited to announce some work that's being done in support myself and a lot of other individuals, not just at Nebraska Medicine or UNMC, but throughout the state, to be able to support the excellent work that's been done with regards to DHHS around training and the accessibility and availability of resources. Now, as I mentioned, this partnership was intended to be able to optimize the accessibility and the variety of training that occurs for those resources, just for our health providers, but also for other citizens and others throughout the state of Nebraska. Now, if you go to the DHHS website, so dhhs.ne.gov, I'll say that again, dhhs.ne.gov, it's the main website, and about halfway down, you'll see a button or see a web link for the healthcare provider information. If you click on that, you'll open up and you'll see a lot of information that work together. So our goal was to be able to group information, to be able to organize it in a fashion to make it widely available. So those resources are easily accessible. There's no dearth of information available with regards to COVID-19, but sometimes sorting through and finding that resource is a difficult thing to do. Our goal was to be able to try to help people find that information, find that guidance, find that training to allow them to better do their job. Now, the intended audience, of course, was healthcare workers. That goes with the title. But it's not just that. The intended audience also deals with local health departments, critical access hospitals, frontline providers, and first responders as well, and many others as well, because as it takes a community to really combat COVID-19. Now, the information available is wide and broad. We've broken it out, and currently there are 10 what I would refer to as buttons that are there that focus on, say, the clinical care, how a doctor or a nurse helps to provide care for a COVID-19 patient, broken into PPE or personal protective equipment, which I'm sure everybody's heard about. Really important things like self-care and mental health, contact tracing, which is a real big issue for the state and something that HHS has really worked to focus on is the contact tracing, and things like how do we actually best optimize, say, the long-term care facilities. We're understanding that those are oftentimes those micro hotspots that exist in Nebraska. So a lot of opportunities, and there's a lot of resources that are available. Now, there's been a lot of partners that have helped with that. Of course, the experts that currently exist at Health and Human Services. I mentioned UNMC and some of my colleagues there, and at Nebraska Medicine, a lot of the resources, we've linked to a lot of the resources that exist there. The UNMC Center for Global Health Security is also a very important partner. If you've heard of NETAC or one called ICAP, ICAP is actually a partnership between UNMC and Health and Human Services to actually really look at infection control practices throughout the state. Now, the last thing that I wanted to try to mention was also on that website, at the bottom, you'll see a link to several different webinars. So for months now, the staff at HHS has worked really hard and done sometimes 3 times a week webinars to be able to provide information for workers, healthcare workers, public health departments throughout the state. Those have backed away a little bit simply because the need has changed. And one thing I'm pleased to announce is that launching next week, actually at UNMC, we're hosting a series of webinars that really focus on clinical care and focus on a lot of topics that are not quite so covered or aren't covered quite as deep as they have been in the past. Things like COVID-19 when it comes to skin manifestations, when it comes to caring for an obstetrics patient, when it comes to caring for kids. Lots of opportunities that exist in specific environments. And for the healthcare professionals out there, you'll be able to access those, watch the webinar, or come back to it at a later time and be able to receive your continuing education credit, which is, as we know, is important for licensure. HHS and UNMC that's just one more example of how we're partnering together to be able to best meet the needs for the citizens of the state. I'll stop there, and we'll stick around for questions as we go further. Thanks.
Thank you very much, Dr. Kaburagi. Also, want to make the announcement that the Federal Department of Health and Human Services has announced a $4.9 billion that will be going to skilled nursing facilities. Skilled nursing facilities that are certified will receive a lump sum of $50,000 plus an additional $2,500 per bed with a minimum, you have to have a minimum of 6 certified beds to qualify. So if you're one of those skilled nursing facilities that has at least 6 certified beds, you'll get $50,000 plus $2,500 per bed, and that will be to help respond back to this pandemic emergency. So good news from the federal government with regard to our skilled nursing facilities. So we'll make that announcement. Also, I want to make some announcements. Obviously, this is Memorial Day weekend, and on Monday will be Memorial Day. Flags will start flying at half-staff in recognition of the holiday and the men and women who have lost their lives in defending our freedoms, as well as recognizing our veterans and their families who have sacrificed to keep us free here at home. In addition, recognizing the folks who have been fatalities to the coronavirus as well. So those flags will be at half-staff, recognizing all those folks. Also, again, normally on Memorial Day, we're doing lots of events to be able to recognize all those men and women who have put on the uniform, recognize our fallen. We will not be able to do that this Memorial Day because of the pandemic. So what we will be doing here at the state of Nebraska is having a virtual Memorial Day celebration, a virtual ceremony starting at 8 a.m. It will go from 8 a.m. to 8 p.m. You will be able to find that on the website, veterans.nebraska.gov/Memorial Day. You can watch it live stream. Starting at 8 a.m., the candle will be lit. And then it's actually going to be lit by Monica Alexander, whose son was killed in Iraq. Her husband Mel will be extinguishing the candle at 8 p.m. I encourage all Nebraskans to, at some point throughout the day, to log on and remember our fallen through that virtual ceremony. We will have 24 honor guards throughout the day that will represent various veteran service organizations that will be standing watch here in the Capitol. So please remember our fallen on Memorial Day. For next week, the schedule will be English briefings. Obviously, we're not going to be here Monday, so no English briefing Monday. But we'll have briefings in English on Tuesday through Friday at 2 o'clock Central Time. We'll have Spanish language briefings at 5 p.m. on Tuesdays and Thursdays. I will be on NET for one last planned event on Speaking of Nebraska, 8:30 to 9:30 next week. That is our last planned event, last planned teletown hall for Nebraska, or for Speaking of Nebraska on that NET show. And again, I just want to remind people, again, to, as you're going about the Memorial Day holiday, please continue to practice those good social distancing guidelines. And remember, the virus does not discriminate based upon race or ethnicity or anything else. So anybody is susceptible to get it, so please don't discriminate against anybody else who has it, and remember that you are susceptible to it as well. So now we'll get into those questions. Sarah Kirkley, NTV, with services like facials allowed under Phase 2 directed health measures, will barbershop rules on masks be relaxed so they can do beard trimmings? And not at this time. Again, that is just for estheticians, so beard trimmings are still not going to be allowed under our DHM for barbershops. Cody Gerlach from the Valley Voice, according to the information put out yesterday, outlining the changes to the upcoming DHMs. It suggests that if a larger family, say a family of 7, for instance, were to attend a wedding reception, they cannot sit together. Why didn't your DHM guidance say households, so that it wouldn't appear to be discriminating against larger families? Again, if you've got a larger family, you're going to a wedding, it'll be okay if you break up that group into 6 people and move them into other tables and so forth. We're going to keep that. Again, the whole idea is to prevent those large groups from gathering, so we're going to keep it. And then managing exceptions is also difficult, so we'll keep it at 6 per table, and you'll have a chance to meet other family members. All right, Ryan Kumpf, KJSK. In regards to youth adult sports reopening as we move into Phase 2, June 1st, under the new statewide DHM, can local health districts impose further restrictions beyond the guidelines approved by the state? And the answer is no. And under the new DHMs, are swimming pools allowed to be open? And the answer to that one is yes. So we'll put out, again, that will be under the venue of 25% occupancy, and we'll have some guidelines out with regard to swimming pools too. Caleb Henry, KGFW. With the inclusion of rodeo as an allowed sport due to non-contacting other people but the ground, are there other contact category sports that are going to be allowed as well, particularly cheerleading, diving, gymnastics, which, like rodeo, are more contact with ground or water rather than others? Stunts for cheerleading would only be possible person-to-person contact listed. So again, for some of those, yes, diving, you're contacting the water, that's allowed. Snowboarding will be allowed. That's a contact sport, but it's contact with the ground. I don't think that's going to make much of a difference this summer in Nebraska, but that would be allowed. Gymnastics, again, you can't have the close contact on that. So we can put out some guidance with regard to that. Otherwise, if you're not having people in close contact, but we'll have to come back to you on cheerleading and be more specific on that one. But again, the idea is for these contact sports, if they're contact with the ground, those will be allowable. And Taylor, where'd you go? Taylor.
Right here. Charlie Brogan would like to know, is there anything in any of the DHMs regarding petition gathering? One of someone he knows just told him that she has had 2 people knock on her door with a marijuana petition.
So Charlie Brogan wants to know, is there anything with regard to petition gathering? Somebody apparently has had somebody collecting signatures for marijuana knock on their door twice. So my concern about the petition gathering is that those circulators will circulate the virus. We do not have anything specifically in the DHMs with regard to the petition gatherers. However, if they're not, one of the things we found, or there's been at least some anecdotal evidence of, is like, for example, in choirs, when people are singing, they're basically expressing out the virus if they're infected. And to do a petition properly, to do it legally, the person has to read you the petition. That means they're going to be in close contact with you for a long period of time. So you have to remember that they're going to be talking at you. If they're infected, they could infect you. And so if they come infected, then you may end up then having to be quarantined if they do, right? So that'll be something that will be considered a close contact if they're within 6 feet of you for over that 10 minutes long. So, and if they're not wearing a mask, of course, they're more likely to spread it. If they're, like one of the things we did during the election, right? We gave everybody a pen. If you showed up at the polls, we had all of our folks wearing masks and gloves, and we gave you a pen that you could then use to fill out your ballot, and you took that pen with you. If the circulators are reusing that pen, that could spread the virus. If they're not wiping down their clipboard in between visits to allowing people to sign, that could spread the virus. So there's so many opportunities for these petition circulators to spread virus. I would be really cautious about interfacing with any of those people. If they're going to your house, then they're going to the person next door. That's just a way to circulate the virus around your neighborhood. So again, obviously you'll be at your own discretion with regard to what you want to do with regard to circulators, but there's so many opportunities for them to spread the virus. I would certainly take that all into mind before you start listening to their petition and what they want you to sign.
Danielle from MTV has a question about dancing at weddings. She says that at gyms and other certain clubs can open with restrictions, Why isn't there a plan for weddings to have dancing?
Danielle NTV was asking a question about dancing at weddings. For example, there are bottle clubs and bars are opening up. In those DHMs specifically, we said you had to keep 6 feet of distance between you and the entertainers. Dancing, we do allow dance recitals. So again, if you're doing a dance recital up on stage, that is fine. However, again, you've all been to weddings. You know that the dancing on a dance floor is close contact. It is not the same. So that's why dancing at weddings is still going to be prohibited.
Christian with NTV wants you to comment on President Trump's move to make all churches and houses of worship essential.
Christian at NTV wants me to comment on President Trump's move to make all churches and all houses of worship essential. Again, we released or relaxed the restrictions on houses of worship at the beginning of May. We think that's a good thing, and so I would certainly support President Trump as he's supporting our houses of worship across our great nation.
Bill from 1011 has a couple of questions, starting with the number of ICU beds is increasing. He wants to know, is there a concern about having properly trained nurses to care for patients? He's heard anecdotes about maybe there's a lack of ICU trained nurses to care for coronavirus patients.
So Bill Shammert is asking about the ICU bed availability, which is still at 36% statewide. But in the Omaha area, we're paying close attention to that number because that number is getting smaller, and about the staffing of those beds to make sure that there are trained staff nurses, and is that an issue? And that's a conversation that Dr. Antone and I have been having. Dr. Antone has been in touch with all the hospital systems, specifically in Omaha, where this is an issue. It really isn't an issue in the rest of the state. We are keeping a close eye on Omaha. I believe the hospital data shows that we were under 20% ICU bed availability starting today. So we're having conversations about what they're going to do with regard to staffing, if those hospitals are going to go out and get additional staffing services to come in, if they're going to flex other parts of their workforce to be able to do that. But it is definitely something we are paying attention to and having conversations with the hospital system, specifically in Omaha, about how to address.
He also wants to know, cheer is on the contact sport list, but are cheerleaders able to practice if they don't do stunts?
Cheerleading is on the contact sports list, but are they able to practice if they don't do sports? We just had that question. We'll have to get back to you on that. Again, some of the other ones, like diving is contact with the water, but cheerleading, again, the stunts is where we have the problem with it because that is actual contact. There's no way to throw somebody up in the air without touching them. So we'll have to get back to you on that one. But for right now, it is still prohibited.
David Earl said that Governor Reynolds announced on Thursday that anyone who needs a coronavirus test in Iowa should be able to get one. How close is Nebraska to achieving this, and is that a goal we're working towards?
So David Earl asks about Governor Reynolds' statement that anybody in Iowa should be able to get a test if they want one, and how close is Nebraska to be able to do that? Obviously, we've got the Test Nebraska program to be able to do that. We've got just shy of 150,000 people have signed up. We've purchased 540,000 tests, so we are working to be able to make that available. So please sign up, and if you are qualified, again, if you're 65 or older, one of those healthcare workers, first responders, somebody in the food processing industries are getting prioritized. Symptomatic people are getting prioritized. So we will work our way down that list to get to people who are asymptomatic. So please sign up, and that's going to be one of the ways that we're going to be doing it through that. And we're looking at other ways to expand testing as well. So we are continuing looking for ways to be able to expand testing so that when people want that test, they can get it. We're at the point right now we're still prioritizing those groups I just mentioned, but as we work our way through those groups, we'll be loosening up those restrictions.
That's all I got for now.
All right. Those are all the questions that have been emailed in ahead of time. Questions from people in the room? Yes.
So I know that Easter was during the pandemic, but Memorial Day weekend is another one of those big holidays. Based on where we are in the pandemic, do you think Memorial Day is going to be a real test for Nebraskans? Do you expect a spike in cases afterwards?
So the question was, with Memorial Day, do we expect to see a spike in the tests, spike in cases afterwards, which would probably happen about 2 weeks later? Again, if Nebraskans follow our rules with regard to respect the 10-person rule, don't have celebrations greater than 10 people. If you're in one of our areas that is still more heavily impacted, as noted in green here, stay home. Stay home with your family. Don't go anywhere. Don't travel to someplace, and don't have people from the other parts of the state come to travel to your location. So we are asking people to make sacrifices during this time, and during this Memorial Day holiday, again, Best practice is going to be celebrate just with your household family members, but in no case have a celebration larger than 10 people. So we're still encouraging people to follow those guidelines with regard to the 10-person rule and all of our other rules with regard to 6-foot physical distancing, washing your hands if you're going to go to the store. Say you want to go out and buy some things to be able to do some gardening, wear a mask when you go to the store. So these are all the sorts of things that will make sure that as we celebrate the Memorial Day weekend, we don't spread the virus and we don't see that spike 2 weeks from now.
So that's a no. You don't think you'll see a spread after Memorial?
If Nebraskans, so Paul says that's a no. I said, hey, if Nebraskans follow the rules, we'll be in fine shape. If we continue to practice social distancing, if we wash our hands, if we respect the 10-person rule, we will be fine. But Nebraskans have to follow those rules. That's what this is all premised on, is people following the rules.
Can we get the detail on the hospital usage in Omaha? I mean, I think you said it was 20% now.
Dr. Anton, do you happen to have those numbers on? Can you come up and just give us those numbers, please? Thanks.
Maybe Lincoln too, because you're Lincoln too.
The question was the real hospital numbers that we see today. We reported them yesterday too for both Lincoln and Omaha. And I'm going to start off with the good news. The good news is the number of hospitalizations for COVID-positive patients yesterday in Douglas County was only 1. So that was a very.
The net new.
Pardon me?
That was the net new.
That was the net new, yes. So we only went up 1 COVID-positive hospitalization yesterday from 134 to 135. Our general bed occupancy remains at around 30%. There's 439 beds available in Douglas County out of about 1,600 beds total staffed. The ICU is down to around 20%, 61 available ICU beds out of a total of around 365 beds.
That's a little under, isn't it?
It is a little bit under 20%. And since there was really no increase in number of patients that needed a ventilator yesterday or ICU rooms, those are probably due to just people coming in with their medical issues. And again, I can look at these numbers all day, but the real data is talking to my colleagues, the CMOs and the doctors that I used to work with, and asking them what they're feeling. How are they feeling about things? Are they feeling that things are getting out of control in Douglas County? And not one of them is saying they are. So, and like the governor says, there are plans in place if we do need ICU nurses. They're actually using some of the critical, or the CRNAs, the nurse anesthetists in the ICUs now to help with ICU care. There's all other means to help with ICU care, such as having a nurse maybe take care of 2 patients at a time or 3 patients at a time, but then getting them extra help for turning and all the other issues that nurses might do. So there's various methods they could do that. And they could always, like the governor said, go to a staffing agency. And those plans are all in place. So
give the data for Lincoln too, please.
the Lincoln data really hasn't changed any at all from yesterday. They have a 35% general bed occupancy rate, 134 beds available out of 378. They only have 41 COVID positive patients in Lincoln Lancaster. There's 51 out of 138 ICU beds available. That's 37%. And there's 190 out of 230 ICU beds in Lincoln. And that's only 12 of those patients are on ventilators. And that's the other beauty of it. We've transferred patients from Grand Island, Kearney, North Platte to Omaha. I mean, CHI could transfer to Lincoln if they needed to. CHI has quite a few critical access hospitals and community hospitals they have partnerships with if they need to transfer patients. Same thing for both University of Nebraska and Methodist Hospital. So overall, I think I could look at these numbers all day, but my real feel is talking to the CMOs and doctors that are taking care of patients, and so far nobody feels really overwhelmed. Just ICU staff working real hard. I witnessed it myself a couple times, and we can only thank them so much for all their hard work.
I have another question for you, if you don't mind, Dr. Anderson.
Sure.
I think just to ease the general public, everyone hears these percentages of availability in Lincoln and Omaha, and this is prior to June 1st restrictions being lifted. Can you give the opinion of why it's appropriate to lift restrictions despite the availability, such a low slim margin, and that margin going inevitably with more cases could get closer to zero availability?
So Lee asked the question, is now that the restrictions are even going to be more lax as of June 1st, and we're seeing a little bit of an increase in or less bed availability in Douglas County. Do you think this is the right time to go ahead and do that? And the governor says this all the time. I don't think there's any right or wrong time. It's the analogy he gives about driving down the interstate at 5 miles an hour. Sooner or later, you're going to have to lift some restrictions. It's my job and everybody's job on my team to make sure that we do have that bed, do have that ICU bed, and do have that ventilator and staffing availability. And that's what I do every day.
That's happening right now. Are you afraid June 14th rolls around and you see these restrictions have lifted for those 2 weeks and those caseloads will start to go up again now?
My personal opinion is I can't predict the future, but I'm not worried about it right now.
Governor, a couple of questions on the statistics you cited from Honey Court.
Yeah.
What was the percentage of the population that was Caucasian?
80% of the population in Douglas County is Caucasian, and they made up 17.5% of the cases.
Well, that puts you well over 100% because.
Let's see, 80. Oh yeah, it does put us over. It must be a little bit less than that.
Okay.
So it was, yeah, you're right. So that's 23, 27. Yeah, you're right. Sorry, I must have got that number a little bit wrong.
Okay, well, maybe I can check on that.
Yeah.
later.
Yeah.
And the lesson you drew from that was the virus doesn't discriminate, but it appears like the minority, at least the Latino and the Asian communities are way disproportionate.
Well, that's what I'm saying. Is they've been disproportionately impacted. There's no doubt. But if you look at again the fatalities, it's the Caucasian community that has got the vast majority of people who are the fatalities. My point is, the disease doesn't discriminate. Neither should we. So we need to be treating everybody who has the virus and make sure they're getting the care they need, that we're not discriminating against one group versus another group, and that the virus doesn't care who you are, it's going to come after you.
Do you suppose the Caucasians are higher because that's the older population?
Could potentially, yeah, again, the question was why Caucasians are having a higher fatality rate, and it could be because they're it could be an older group of people who are getting infected, more underlying health issues. Could be another issue as to why. Paul?
Can you ask a couple questions about testing Nebraska? One is, I know they had some testing at the One World Center a couple weekends ago, and they ran out. Why not use Test Nebraska in those hotspot areas to supplement, since they have much bigger capacity, I think, than the other labs?
So the question was with regard to testnebraska.com. One World, we've been doing regular National Guard testing, and we had to turn people away, and the question is, why don't you bring the testnebraska.com in there? Again, the way the testnebraska.com is, and one of the reasons they have higher capacity is because people sign up for slots ahead of time, which we're not requiring necessarily for what's going on One World, right? People are just coming in and lining up to be able to do it. So it's a different system, which is one of the reasons why Test Nebraska can process more people. If you sign up ahead of time, got a time slot, we can process that through. So, but not every testing solution fits every person, right? We want to have a variety of ways for people to get tested. Some people are going to feel more comfortable doing it the way we do it at One World versus doing the testnebraska.com. Now, having said that, we do put the testnebraska.com in different places. So, for example, we've had them in Grand Island or Lexington or some of these other places where we have had higher incidences associated with different food processing facilities. So we'll still do that, but it's got to fit the right person. So testnebraska.com is absolutely available for people who want to sign up in Lincoln or Omaha, right? You can still do that. You can go to One World if you want. You can go to Charles Drew if you want, or you can sign up for Test Nebraska and do it at the CHI Health Center in Omaha, or you can go to CHI's clinic on 24th and Cumming. I believe they got one set up maybe on 108th and something. But the point is there's multiple test sites with different ways to be able to access that. And it's really to accommodate the needs of the people so that however they're most comfortable, they can access it the way they want.
And you know, I think you've indicated, well, I'm hoping they get to 3,000 bed a month, but it sounds like you don't think they'll get there. How can you say you still support this program, even though it's not quite meeting your expectations?
So why am I still supporting testnebraska.com as we?
Meeting its benchmarks.
Well, first of all, we still continue to meet the benchmarks, Paul. Actually, we haven't reached the 3,000 tests a day yet, but we knew it was going to take time to ramp that up. And again, folks, this is like a startup business. You know, when you start up a business, the first casualty of every battle is the plan. So you find out things that you can improve upon, and that's what we've been doing with testnebraska.com. So we find something we can do a better job on, we fix it, and we move on and try and do a better job. And the fact of the matter is, we are testing more people because of testnebraska.com. You cannot dispute that fact at all. So it is added on to the number of testing we're doing in Nebraska. That's a good thing. People should be happy about that. That's what we want. We want more tests here in Nebraska. We want to make that access more available to people.
What are you up to? It was 1,200 the other day.
I think we're up to about 12,000 tests returned now for Test Nebraska.
Per day.
Oh, I don't have that number off the top of my head with regard to it. I think that's actually still one of the things we're still trying to pull out of the data is how many tests per day we're on it. Do you have how many swabs we did yesterday by chance? So remember again, there's a difference between how many people we swab versus how many tests get returned because you've got to go process those. Do you happen to have those by chance, Dr. Anton?
Yes, looks like yesterday was 1,155.
So yesterday was 1,155.
And that's specifically tested Nebraska.
That's specifically testnebraska.com, yeah.
That still isn't meeting, average of 500 per site per day.
Right, we still want to get that up to 500 sites per day. You're absolutely right, Paul. We want to continue to get more people processed and get more swabbed and more tests back, absolutely. But it's also more than 1,000 tests that we've done.
Sure.
Do it without it, right? And here's the other thing to remember too. So we're ramping up testnebraska.com. If you look at through the end of May, I think we had tested about 27,500 people. Probably today, maybe tomorrow, we will have more than double that just in the month of May. And the month of May is not even over yet. So we have vastly increased testing here in Nebraska. So that is a good thing. We want more testing here in Nebraska.
And I know you say you're pushing your team to get to 3,000.
And we are pushing those folks to get to 3,000 tests a day,
What do
absolutely.
you need to do to get to 3,000?
Well, to get to 3,000 tests a day, we will need to get 6 teams stood up and going around the state. And again, we'll need to make sure that we get people signed up so we can continue to process it. In places like Omaha, I think that we're doing that, where we have a lot of people who are signing up for slots, and some people are not even able to get slots. We want to continue to make sure those folks have access to it. Then again, as we move around the state and go to smaller communities, like we're in Clay Center, it might be difficult to get to 500 tests a day, but we still want to go to Clay Center. So we got to take this all into consideration.
More people in the lab to process the tests, or getting better at processing the tests, or getting more people at the test sites? What is it?
So Paul's asking about what are other process improvement type of things we can do to make sure we get there, whether it's more people in the lab, better process in the lab, getting more people signed up, and the answer is yes to all those things. So that the team is looking at all those things with regard to how we can continue to increase the testing for testnebraska.com.
Charlie Brogan has a question for Dr.
I'm going to go Lee, and then I'll come to Charlie Brogan.
I was gonna have a question, if you don't mind, about the educational thing you guys launched a week or however long ago, how that has come along and what you guys have seen progress-wise. You kind of mentioned you're trying to ease into this. What is that website provided for you guys, and what steps can you give on an update towards summer and fall classes specifically?
Yeah, so the basic question is what's kind of the progress so far on Launch Nebraska or launchne.com on the, really what that website does is set up a set of processes around the state. And we're asking schools and school leaders to be having conversations across certainly across their districts, but also with other districts. So now we have multiple groups that are actually doing work to review those processes and procedures, working with local health. We have the largest schools in the state as well as the smallest schools in the state having conversations. And I would say for the majority of schools, at least one person from a district's involved at least in part of those conversations. There are probably many, many more than that. We're reviewing the guidance from CDC, the guidance that local public health has, the guidance that state health has, looking at the types of things that will make a real difference of keeping students safe in a school environment, looking at the protocols. How do you know when it's safe in a community, and how do we kind of gauge what the level of risk is and what the procedures ought to be? So really every detail that you can think of that has to take place in schools is being reviewed given the risk that we have with the pandemic and the spread of the virus. I think what will happen is that will evolve, and we'll see guidance being placed there. In fact, even what we're doing on looking at summer learning, we'll place more guidance there next week, and we'll start to build that those guidance documents out, allowing schools to use those documents as we go forward.
What's the challenge been like with this guidance from even the state to the CDC level fluctuating from month to month, week to week in some cases? Because that puts an impact on what you guys can do for these schools.
Yeah, really, we're really looking at it as really empowering local officials with information about what the best practices are. And so there has been kind of what I'll say mixed messages, whether from CDC, sometimes they put out guidance that was very generalized, and this week they put out guidance that was very specific. And not every piece of guidance that comes is a mandate, right? In fact, it might just be, here's some good ideas that you could practice. But we have very small schools in the state of Nebraska that their ability to do social distancing might be relatively easy in certain settings. And we have very large districts and buildings where they're having to think about different strategies that will ultimately make a difference. I mean, when you think of bus procedures and feeding students in normal cafeteria settings, all those things are being explored. And as we do that, we'll explore those procedures with local health officials. Actually, UNMC, we have a contract with them to do some work and kind of do some oversight on that front as well. The national guidance is helpful because you can see this conversation's happening all over the country. For me personally, I'm in national calls, and I keep looking for the person that has all the answers, and we have not found them yet. So we think we're going to have to find those answers through this process with our local officials.
Thank you, Commissioner. And sorry, Charlie Brogan was looking for who?
Yeah, he
Taylor?
wants to know from Dr. Anton, is it time
Dr.
to
Anton.
is it time to let people visit patients in hospitals again?
Repeat the question.
So Charlie Brogan wants to know, is it time to let patients be visited in the hospitals at this time? And I would say let us get by the next week or two or three and then revisit that question. We'll see what happens, especially in Douglas County. My thought is it might happen on a region by region basis first, because every place else in the state now outside of Douglas County is very, very stable. So we'll revisit that question as we go on.
Paul.
Quick question, 11 senators have signed a letter, I think they've probably seen it, asking you to use the CARES money for rental assistance. They think when the eviction directive expires, there's going to be a rush to evict people, and they're not going to have any money because they're not at work. What would you say to that?
Sure. So 11 senators have signed a letter. I actually have not seen it, but apparently 11 senators have sent me a letter saying that they want some of the CARES Act money to go to eviction notice. I'd say stay tuned. We're going to be having a plan with regard to our CARES Act money, so we'll get that all rolled out, but I'm not prepared to talk about that right now. So just stay tuned.
We know how much.
Yeah, Brandon.
Just regarding county fairs, you made an announcement yesterday where fairgrounds can be open with some of these new guidelines, but like today, Madison County, one of the bigger ones, canceled their fair that's happening in July. So do you have any advice for fairs that are trying to make that plan based on the plans that you've rolled out? And I know you said before that it's going to look different, but do you have any advice for county boards trying to make that?
So the question was, do I have any advice for county boards who are looking at their county fairs and whether or not to cancel them? Because Madison County apparently canceled their fair yesterday. Again, we put out the guidelines in the DHM with regard to how those venues can be open, and we have a group that is working on specifically on county fair guidelines. So we will be putting those guidelines out, and I'd say just when those guidelines come out, every county is going to have to evaluate and see whether or not it makes sense for them to have their county fair. So I would say if you are still interested in having your county fair, look at those guidelines when they get published, and then make that decision. Right.
The Logan Elkhorn Valley Health District has put out a press release saying they're seeing clusters of people infected with COVID-19 at dental clinics, restaurants, nursing homes, daycares, manufacturing facilities, and gas stations. They say they're seeing that, and they're saying it's happening across the state. Does that square with what you're hearing?
So Elkhorn Logan Valley is saying that they're seeing clusters around dentist office, gas stations, restaurants.
Homes, daycares, manufacturing.
Yeah, so we're on a call daily with all the public health directors, and that has not been mentioned at all. So I don't know where that data is coming from, so I can't really comment on it, but they must be really small clusters.
One patient per hospital.
Like maybe it's one patient in the hospital, I don't know. But I haven't seen that data, so I really can't comment on it. Paul, did you have another question?
Well, I wondered if you know how much CARES Act money has been spent so far?
The question was how much CARES Act money has been spent so far. I don't have that number off the top of my head, but I appreciate the feedback on that one because we can work on that for when we come back with next week we can get that answer for you. Other questions? Yeah, Lee.
What has been the most difficult, I mean, you make decisions consistently across the board that you have to provide to the state. I mean, what are some of the difficult decisions that you really step back and forth on? Like, do we go ahead with this? Do we not go ahead with these? That decision process has to be difficult. I mean, you mentioned you talked with Dr. Anton a lot with the DHMs. What is that back and forth process like, and not to do, yes to do kind of thing?
Yeah, I mean, there are a lot of difficult decisions that we have to make. They all impact people's lives. I give the example of the daycares. We know that if parents can't get access to daycares, they can't necessarily go back to work. And we know that that's important for people's mental health as well as their economic well-being and so forth. But we also have to balance that off against what is the risk of spreading the virus more. So it is, and again, there's no playbook on this. Nobody's faced a pandemic like this in our country in over a century. So we just try to make the best decision we can with the data we have at the time, and that's where we talk a lot with Dr. Antone and his team, the other public health directors in the state, the local ones, the folks at UNMC. We have daily communication with all these folks talking about these issues, and we just try to do the best job we can. Yeah.
I know you sent out a press release touching on April's unemployment numbers. How are you feeling taking a look at those compared to past months?
So the question was about April's unemployment numbers, which are at 8.3% unemployment, which is a record here in the state. I think the last time we were even close to that high was in 1983. We were at 6%. But even with that high unemployment number, we are actually the third best in the country with regard to unemployment rates. So, it's a kind of a good news, bad news story. We've got a lot of people unemployed, but it's not as bad as it could be. And that's why, we're working very hard to make sure that we get through the cases that we've got, the applications, the executive orders I've signed to make that easier and cut away some of the red tape to be able to get that done. And John Alden, the Commissioner of Labor, and his team are working really, really hard to be able to turn those applications around and get that money out to folks. So it is one of the things that we're cognizant of, that families out there are being impacted, and we're working to be able to get that unemployment insurance checks out there as quickly as possible, as well as the pandemic unemployment.
Governor, the Department of Ag has the fair guidance posted to their website now.
Excuse me?
The Department of Ag has the fair guidance posted to their website now.
Department of Agriculture, Brandon, getting back to your question, Department of Agriculture has their fair guidance posted on their website. So again, my advice to counties who are thinking about their county fairs, go consult that fair guidance and use that as you think about whether or not you want to go forward with your county fair. Yeah.
As a follow-up to my unemployment question, do you happen to know how many people are still waiting for those unemployment checks, or?
So as of yesterday, and I don't think the numbers have changed that much, John, have they? So yesterday, take a step back. Last week of April, we had about 60,000, a backlog of 60,000 cases. We've got that down to about 11,000 now. Is that right, John? So a little over 11,000. And that represents roughly 2 weeks worth of claims if we're getting about 6,000 a week or something like that. So not that all those people just filed within the last 2 weeks. There are probably cases out there longer. But roughly you can see that we've dramatically reduced the backlog on that. And remember, even if we're hitting, I think you made the point yesterday, John, 85% getting within 28 days, if you still have 15% that are not within that 28 days, and you've got over 100,000 claims, you still have a lot of people who haven't hit that 28-day mark that we're shooting for to be able to get back to. So we want to get back to over 90% within the 28 days. And so we've still got some work to do, but John and his team have been working hard to get those checks out.
We have time for one or two more questions.
So a couple more questions, Paul?
Can I just follow up on the rental assistance question? You said stay tuned. Is that to suggest that some of that money may be used for rental assistance, or you've got some plan to help folks?
Stay tuned. Paul's question is on the rental assistance. What does stay tuned mean? And stay tuned means stay tuned. We will have a broader plan that we're going to roll out with regard to what the CARES Act money is going to go. Though I would highlight, though, that we've now got the pandemic unemployment insurance money out there at $600 a week that has been being paid for how many weeks now, John? When did we start paying that?
Since March 29th.
Since March 29th, the $600 a week checks have been going out, so people who've been receiving that should have the capability to be able to make their rent payments.
Last question.
Last question. And seeing no last question, we're going to go ahead and wrap it up for the Memorial Day holiday. I know I see some visible people like, yay, back there. So thank you all again to all the Nebraskans who have been working so hard to be able to slow the spread of coronavirus here in the state, whether it's folks in our healthcare system, our long-term care facilities, our hospital ICUs. We've had so many people working hard. We've got Nebraskans all over the state that are sacrificing, taking, following our restrictions, the 6-foot rule, the 10-person rule, wearing masks in public. I see Fred's got his mask on already again. Good job, Fred. So thank you to all of you for what you have sacrificed. It has worked. We have slowed the spread of virus here in the state. We have preserved our hospital capacity in the state. We need your continued help, especially as we go into this Memorial Day weekend, to continue to respect the 10-person rule, to continue to do all the good hygiene around washing your hands and staying home when you're sick and staying 6 feet away from people, all of that. Please continue to do that. That is what allowed us to be able to be successful here through this emergency. Thank you all. Again, remember it's Memorial Day weekend. Please keep in your prayers all of our fallen, those men and women who died to give us our freedoms, and recognize our veterans and their families for the sacrifices they make. God bless you all, and God bless the great state of Nebraska. We'll see you back here next week.